difference between neuromuscular and internal derangement joint problem.
Dear colleague, this is a very important topic, and it's very important for you to know how to differentiate those two problems. In general, functional problems can be divided by neuromuscular problems or internal derangement, or maybe combination of both. If we want to talk about the neuromuscular problems, we can connect them with problem of the bite, interferences in the contacts. When you do muscle palpation, for example, when you palpate pterygoideus lateralis or pterygoideus medialis, or maybe temporalis and masseter muscles, they can be painful. And this can be connected with neuromuscular problems. Of course, this can be also in combination with internal derangement, but this in the future you need to know to do the differentiated diagnosing with the additional tools like CBCT and MRI. Of course, when the patient is on the chair and when you ask the patient to open, you can see if there is any deviation, like sideways or left or right, or some kind of shaking of the lower jaw. This can be connected with internal derangement problems. Of course, CBCT is a great tool that you can dissect the joint on your computer and see how much is the space between the bony structure, condyle, and the joint fossa. Also, you can analyze the shape, form, and maybe if there is any resorption or cyst in the condyle. Of course, MRI is a great tool that you can use to see how are the discs, how is actually the soft tissue of the joint, maybe with open mouth or maybe with closed mouth, or you can see the combination of both. So you need to be able to use your clinical experience and all of the tools out there that can give you a very precise diagnosing, and of course to know if this is an internal derangement or neuromuscular or maybe combination.